As more and more countries are on lockdown due to COVID-19, and an increasing number of people are living in isolation, the question on everyone's mind is, when will this be over? We look at what experts have to say. All data and statistics are based on publicly available data at the time of publication. Some information may be out of date. Visit our Coronavirus Hub and follow our live updates page for the most recent information on the COVID-19 outbreak. Living in self-isolation has profound socio-political implications, in addition to the effects that it has on a person's mental health and well-being. Although more and more studies are showing that quarantine and isolation methods are indeed effective and that we should all continue to keep our physical distance, it is hard not to grow impatient and wonder how long this is likely to last. Medical News Today have spoken to several experts in infectious diseases, and in this special feature, we round up their opinions on the matter. We also look at some of the predictions that other researchers have made on the availability of a vaccine and the impact it will have on the outcome of the pandemic. The importance of vaccines in ending the pandemic is undeniable. But when will such vaccines become available? And should we wait? Some experts have warned against relying on vaccines as a strategy for ending the current crisis. Most vaccines are still likely to be 12 to 18 months away from being available to the entire population, and this period is long enough to cause lasting social and economic damage if the lockdown persists. Speaking to the BBC about whether governments should rely on the advent of vaccines to end the pandemic, Mark Woolhouse, a professor of infectious disease epidemiology at the University of Edinburgh, United Kingdom, says, "Waiting for a vaccine should not be honored with the name strategy. That is not a strategy." However, some researchers are optimistic that a vaccine will be available much sooner than the often quoted 12 to 18 months mark.